To today's press briefing. We have with us two speakers, and they are from the Center for Health Protection, Principal Medical and Health Officer, Communicable Disease Branch, Dr. Albert Au, and also Dr. Gladys Lee, Chief Manager from Hospital Authority. They will give us information about the HA and update on number of cases. Dr. Kwan, we have 2,647 patients staying in hospitals. 233 of them are new cases. For those staying in isolation facilities, there are 468 patients in isolation wards, 171 patients in second-tier isolation wards, 493 patients in Infection Control Center, North Dental Hospital, and 217 patients in AWE COVID Treatment Center. 149 of them are new cases. We have newly reported 7 patients in critical conditions, 11 in serious condition, and for those inpatients, 56 critical patients and 59 serious patients in total. 17 critical patients are receiving ICU care. Of those who passed away, we've reported 10 new cases, 7 male and 3 female aged between 55 and 93. Of the deceased, 7 have not completed their 3 doses of vaccination. The relatively younger deceased, aged 55, has got cerebral palsy and with hypertension and diabetes. He could not take care of himself, require family care. In early September, because of a poor mental state and fever, upon arrival at A&E department, the patient was RAT positive with a high CT value, and then there was opacity in his chest X-ray. Anti-oral drugs did not bring any marked improvement. The patient passed away yesterday. 225 patients recovered. 187 of them have been discharged. There are 5 patients who tested positive via admission, screening, or testing. 9 patients in the same ward are classified as close contacts. We have another 124 staff members confirmed. 99 employees have returned to their duties. That's all from me. Over to you, Dr. Au. Thank you. I'd like to report to you on the number of cases as of yesterday, the 18th of September. We had a total of 6,068 local cases, 1,479 of them PCR positive, 4,607 RAT positive. 174 imported cases were noted yesterday, 154 PCR positive and 20 RAT positive. We had another 10 cases of death yesterday, as reported by Dr. Kwan. So far, in the 5th wave, Hong Kong has recorded 9,688 death cases. Of the 174 imported cases yesterday, 95 were picked up at the airport. 47 at quarantine hotels or centers. The remaining 35 cases were found in samples collected at community testing centers. 25 of them were samples connected between days 4 and 7, and the remaining over 7 days. They came from 39 countries. 5 countries have imported more than 10 cases: UK, Philippines, Indonesia, Thailand, and US. The remaining 34 places imported 10 or less cases to us. For care homes, there were 4 care homes with new cases yesterday, 3 homes for the aged, 7 residents positive, and 1 care home for the disabled with 1 resident positive. 58 residents are now classified as close contacts requiring quarantine. We have 1 from Kwun Tong, Polang Kok Siuming, Guilin Wulu Yun, 3 residents positive. In Wong Tai Sin, Chilin Nunnery, Jilin Honor Yun, 1 resident positive. Shatin Mankuk Loan Yun, 3 residents positive. The remaining one is in Yuen Long, Hong Kong Spastic Association, Yiulang Sukse, 1 resident positive. For schools, Well, starting from Friday afternoon to this morning, we've received a total of 1,881 positive cases, 168 of them involving students and 263 teaching staff. 860 schools are involved. 207 of them are either KG or CCC, 345 primary school, 291 special secondary school, and 23 special school. Cases reported to us this morning for schools with 2 or more cases, there were 675 of them. Schools reported to us today, 20 have individual classes with clusters. We've advised that these classes be suspended. 8 KG and CCC, 2 primary schools, 9 secondary schools, and 1 special school, involving a total of 22 classes. 90 schools have got 1 class affected. The remaining school is a special school with 4 students affected, spread in 3 classes. Is in Dongchong Hongji Xiubang Sanfai Hao. They all live in dormitories in the same room. The remaining 12 students in the same room are now under quarantine. For schools who had to suspend classes previously, 3 have got new classes that have to be suspended. 2 secondary schools with 2 classes each. The remaining one is a KG CCC in North Point, Fanling, Sanjiahui Kindergarten. The school had 2 classes suspended on the 13th and 14th of September, respectively, involving 2 classes, 5 students, and 2 teaching staff. And cases start to appear in other classes. As of this morning, 23 students and 6 teaching staff tested positive, scattered in 10 classes. There are a total of 556 students and 50 teaching staff in this school. About 5% of the students are positive. To play safe, we have recommended the whole kindergarten be suspended for a while. For a genome analysis, Public Health Laboratory tested samples yesterday, and for samples with L452R, they accounted for 84.1%, a slight increase from 81% previously. In Hong Kong, BA5 accounts for about 77.6% of the total cases in Hong Kong, and 6.4% of them BA4, and BA.2, 12.1, 2.7%, and BA2.2, 13.2, 3.2, 13.2%. I open the floor to questions. Please identify your media outlet. The lady in the right, or the gentleman on the right. I'd like to know the address of the kindergarten. Is it in North Point or Fanling? What do you think is the route of transmission in the school? So I'd like to know the number of students affected on average in each class. For the special school in Tongchong, 4 of them live in dormitory. Does that mean that there is a case in each class? And the 55-year-old who passed away, is it a man or a woman? And then experts said that with a high vaccination rate, we can remove some social distancing measures, such as dining in restrictions. I'd like to know whether there is any link between the two, and is that an indicator? Because the experts said that this is a not so effective measure. Dr. Au, schools. The school that has to be suspended is in North District. Is Assembly of God Church. There are 2 classes for the PM and AM sessions together. In the past 7 days, 23 students were positive and 6 teachers affected.
Some classes have more cases, including class 1C. They share a classroom with other classes. For AM class, there were 4 cases. 23 students in total for PM class and 1C class as well, PE 1C with 8 infections, and then the class 3B with 4 infections. The other cases are distributed over different classes. The school has experienced more infections with a percentage close to 5%. And after all, mask compliance is not very good for children. With more cases surfacing, we are worried about possible infection, contagion. So these cases surfaced on Thursday and Friday last week, and it seems the trend hasn't ceased. To play safe, we have recommended the school to suspend classes. It seems that the students did not have meal at schools, and also the children wore a mask. Of course, compliance may not be perfect, and the school has been conducting disinfection, and we advise the students to continue to undergo RAT during suspension. The other school is a special school. The 4 students live in the same room in the hostel. The room has 16 residents in total. So we believe that one student got infected and then got other infected as well. So the hostel is of high risk. The students are either sent back home or undergoing quarantine at quarantine centers. So there are 3 classes, one class with 2 infections. The class has 8 students. The other 2 classes only have 1 infection each. So the 3 classes do not have a lot of students. We have advised the other students from the 3 classes, even if they are not hostel residents, they should not return to school yet. They are class 3P, B3P, P6B, and S1. The third question is about vaccination and also social distancing measures for restaurants. The government will review a series of factors to see whether social distancing measures at restaurants would be relaxed. It would depend on the trend of the epidemic, whether it is a stabilizing trend. If the number of cases climb down, there will be less pressure on the healthcare system and there will be room for further relaxation. The government will continue to closely monitor the situation for room for adjustment. Vaccination is the key measure to keep the epidemic under control. With the full 3 doses, there would be less risk in terms of serious complication or death. Restaurants are high-risk premises because you would take off your mask. Some supplements on the diseased patients. That was a 55-year-old male with no vaccination at all. Next question, please. The lady at the back. Good afternoon, doctors. I'm from Cable News. Still on the 55-year-old male diseased patient. Was his death related to COVID? On which day after infection was he prescribed with the antiviral drug? Are there a lot of cases where the oral antiviral drug didn't help at all? Among the deceased patients reported today, how many of them are related to COVID and how many unrelated? Yesterday, Dr. Au said so far 35% of inbound travelers would be tested positive upon arrival at Hong Kong, during the first 3 days. So are you worried that inbound travelers may bring the virus into the community? On imported cases, we have a very stringent testing regime for inbound travelers. Upon arrival, they would be subject to regular and frequent testing. If they are carriers of the virus, they would be identified promptly and be required to undergo either home quarantine or hotel quarantine. So on arrival at the airport, they would be subject to a RAT and a PCR test. And then on the 2nd, 4th, 6th, and the 9th day, they would be subject to PCR test. For the remaining days, every day they would have to do a RAT. So this is actually within our expectation that inbound travelers, some of the inbound travelers would be virus carriers. So we hope that through a more frequent testing requirements, we can control the risk and identify the cases and isolate the patients as soon as possible. So previously we have adjusted the 7-day quarantine requirements to 3+4. So it is expected that some of the travelers would be found positive after leaving the hotel. So previously, when we had a 7-day quarantine requirement, some would be found to some would be tested positive on the 5th day. So these people would be subject to an amber code, and they would not be allowed to enter high-risk premises like restaurants, and they would also be subject to medical surveillance, and we would be alerted if they are tested, if they become positive. And also we would check whether they have complied with the compulsory quarantine notice on testing. So we would look at the data to see what the next step will be. Concerning the 55-year-old deceased patient, on admission to hospital, we already knew that he had been tested positive with RAT. We gave remdesivir to the patient via intravenous injection. On oral antiviral drug, depending on the patient's medical history and a vaccination record, as well as the symptoms on onset and also the time frame, it would affect the efficacy of the drug. So we can't say whether the drug is effective or not effective. Well, data shows that if antiviral drug is prescribed 5 days before the onset, before the 5 days within the onset, it would greatly alleviate the risk. So for confirmed patients, even if your symptoms are very mild, you should go see a doctor. At designated clinics or tele consultation services, we are offering these services, consultation services to patients. At A&E, we would decide whether to prescribe antiviral drugs depending on the clinical conditions and the risk factors of the patients. The gentleman there, I'm from TVB. A question for the hospital authority. Now the number is climbing down. What is the utilization rates for the beds at public hospitals? And you said there is tele-consultation services available. So how will the smaller number affect the surface level of the HA? We have observed that in the past few days, in terms of number of hospital admissions and also the bed utilization rate, as well as infection rates of our colleague, there is a downward trend. Of course, we would keep monitoring the situation. In terms of non-COVID patients' medical needs, especially non-urgent operations or checkups, which we have truncated before, we are already readjusting these services. Concerning the designated clinics and teleconsultation services, we are maintaining the service level at the moment because there are patients who would opt for these services. We would monitor the situation and see what kind of services can return to normal level.
Any other questions? The one on the left. I'm from Dot News. I have this inquiry from a reader. is an elderly person. On the 4th of September, he tested positive at a hospital. He received information from the relevant department because it's an elderly case. He did not know how to work with the reporting, and his hasn't reported on two occasions, and is already past the deadline. And if the Department of Health is aware of such cases, will it take the initiative to approach the patient, and how would that be handled? Regarding declaration by elderly persons, anyone who tested positive either by means of PCR, whether in a hospital or community testing center, we have an online platform, CDPI, www.chp.gov.hk/CDPI for declaration, because there is a PCR report. After declaration, we can confirm that it's a PCR positive case, and isolation order will be issued to the case, and quarantine orders to family members. So on declaration, family members' information will have to be included. Now for RAT positive cases, declaration can be done by www.chp.gov.hk/RATP. So if it is an elderly person who doesn't know how to declare, we suggest relatives or children or friends help the case to report as soon as possible, because if declaration is done in time, information can be passed to the hospital authority to approach the case as soon as possible for prescription of antiviral oral drugs. And if the case requires community quarantine or isolation facilities, arrangement can be made. If an elderly person cannot find someone to help and doesn't know how to do the declaration, he can call the hotline 1-833-6119, an automatic registration system. So long as you input your phone number, our colleagues will then approach the case, and if need be, declaration can be done by the elderly person and make relevant arrangements. If an elderly person is PCR positive, and we report a report from the HA or the public health laboratory, if we cannot find a CDPI declaration record, then we can make use of the phone number left at a registration of PCR test and approach the case. So may I remind members of the public, when you do a PCR test, ensure that you leave accurate phone numbers to receive an SMS for notification of the results and to facilitate our contacting you. If there are no further questions, the conference ends here. Thank you.